Welcome to our comprehensive guide on nursing health assessment. In this video, we'll explore the essential concepts and practical steps every nurse needs to know to provide quality patient care. Whether you're a student, a new nurse, or looking to refresh your knowledge, this journey will help you understand the core of nursing assessment and the nursing process. We'll start by defining key terms, then move through the types of assessments, the historical development of the nursing process, and practical models you can use in your daily work. Let's begin by setting the stage for why assessment is the foundation of effective nursing practice. By the end of this video, you'll be able to define nursing, health, assessment, and nursing health assessment. You'll also describe the different types of assessments, explain the nursing process and its characteristics, and identify the components and models used in nursing assessment. These objectives will guide our exploration, ensuring you gain practical knowledge and confidence in applying these concepts in real-world scenarios. Let's keep these goals in mind as we move forward, so you can track your progress and see how each section builds on the last. Let's start with the basics. Nursing is defined as the diagnosis and treatment of human responses to actual or potential health problems. It's both an art and a science, using a holistic approach to address patient needs. Health, according to the World Health Organization, is a state of complete physical, mental, and social well-being, not just the absence of disease. Understanding these definitions helps frame the nurse's role in promoting wellness and supporting patients through illness. These foundational concepts are the building blocks for everything else we'll cover. Nursing assessment is a branch of clinical nursing focused on evaluating the general health of individuals using the nursing process. It involves collecting, analyzing, and synthesizing information to make judgments about a client's health status and determine their need for nursing care. This process is not just about gathering data, it's about interpreting what that data means for the patient's current and future health. Accurate assessment is the first step in delivering effective, personalized care. The nursing process is a systematic method for assessing, diagnosing, planning, implementing, and evaluating patient care. It's a deliberate problem-solving approach that ensures each patient's needs are met in a structured way. This process is the backbone of professional nursing, providing a framework for delivering high-quality care in any setting. By following these steps, nurses can ensure that care is consistent, thorough, and tailored to each individual. The nursing process has evolved over decades. In 1955, Lydia Hall first mentioned the term introducing 3 steps: observation, administration of care, and validation. Over time, other nursing leaders expanded the process to include assessment, planning, implementation, and evaluation. By 1974, nursing diagnosis became a distinct step, and in 1991, outcome identification was added. Today, the nursing process consists of 6 phases: assessment, diagnosis, outcome identification, planning, implementation, and evaluation. Understanding this history helps us appreciate the depth and rigor behind modern nursing practice. The nursing process is dynamic, client-centered, and universally applicable. It relies on open communication and collaboration between nurses and patients. Unlike the medical process, which focuses on treating diseases, the nursing process emphasizes teaching independence and involving patients and families in care. Its advantages include providing an organized framework, focusing on individual needs, promoting active client involvement, and offering a systematic method for problem solving. These characteristics make the nursing process a powerful tool in modern healthcare. Let's break down the 6 steps: assessment, diagnosis, outcome identification, planning, implementation, and evaluation. Each step builds on the previous one, creating a continuous cycle of care. Assessment involves gathering data. Diagnosis interprets that data. Outcome identification sets goals. Planning develops strategies. Implementation puts the plan into action. And evaluation checks if goals are met. This cycle ensures that care is always responsive to the patient's changing needs. Assessment is the first and arguably most important step. It involves systematically collecting data about the patient's physical, psychosocial, and emotional health, as well as health-promoting behaviors and potential problems. Data is gathered through history-taking, physical examination, and diagnostic tests. Nurses use techniques like inspection, palpation, percussion, and auscultation to gather objective and subjective information. Accurate assessment sets the stage for effective diagnosis and care planning. There are 4 main types of nursing assessment: initial, focused, time, lapsed, and emergency. Initial assessment is broad and performed when a patient enters a healthcare facility. Focused assessment zeroes in on specific problems identified earlier. Time-lapsed assessment compares current status to baseline data after a period of time. Emergency assessment is rapid and targets life-threatening situations. Knowing which type to use ensures the right information is gathered at the right time. After collecting data, nurses move to diagnosis. A nursing diagnosis is a clinical judgment about how individuals, families, or communities respond to health problems. It includes 3 parts: the problem or diagnostic label, the etiology or cause, and the defining characteristics. For example, ineffective airway clearance related to thick secretions as evidenced by dyspnea. This structured approach ensures that interventions are targeted and effective. Once a diagnosis is made, nurses set goals and plan interventions. Planning involves prioritizing diagnoses, setting measurable outcomes, and involving patients and families. Implementation is putting the plan into action, coordinating with the healthcare team, and documenting responses. Evaluation checks if outcomes are achieved and identifies any needed changes. This cycle ensures continuous improvement and patient-centered care. To organize data, nurses use assessment models. Gordon's Functional Health Patterns is a popular nursing model covering 11 aspects of health and human function, such as health perception, nutrition, elimination, activity, sleep, cognition, self-perception, roles, coping, sexuality, and values. The medical or body systems model organizes data by body system, focusing on symptoms and physical findings. Using these models ensures comprehensive and systematic assessment. In summary, nursing health assessment and the nursing process are essential for delivering high-quality, individualized care. By mastering these steps and using structured models, nurses can ensure their practice is thorough, evidence-based, and patient-centered. Remember, assessment is not a one-time event but a continuous process that adapts to each patient's needs. Keep learning, stay curious, and always strive to improve your assessment skills. Thank you for joining us on this journey. Your commitment to excellence makes a real difference in patient lives.